you look at the diabetes application, all we're basically saying, instead of using pen and paper to record it, just use your touch phone buttons to record information. So from our perspective, it's not. But if you ask a lawyer at Johnson & Johnson or at Pfizer, he'll give you a different answer, because he'll say, oh, what if the patient, presses the wrong number, enters the wrong glucose, and then you say, well, what if they write down the wrong glucose, and then it becomes like, a chicken and the egg. And ultimately, I think the FDA is now, in the last year, and I think Brian Dolan on mobihealthnews.com wrote about it and published, I think, a report, is, starting to kind of put some processes in place to understand how do they approach mobile health, how do they put some frameworks in place for that.
Thank you.
And another question. Go ahead.
Hi, my name is Ketan Shah. The question for Jeff. In your model, how does the interoperability work? Basically, when the information is sent, PHR is sent via phone, how does it integrate with the systems that it's going to, the various health providers, basically? Does it integrate with all of them and all the future ones that are going to come into play?
Well, you ask a really good question, and it's one that historically, integration of personal health records and other applications with other healthcare IT applications like an EMR that you'd find in a physician or a hospital or health system, it was all across the board. And historically, some EMR vendors are really good at integration and interoperability. They do it in a real practical fashion using interoperability standards, and it's pretty straightforward and cut and dried. Other EMR vendors either didn't have that technical capability or, quite frankly, wanted to sort of make it difficult for information to flow freely and sort of create these walled fortresses around information. This is where I think the stimulus funding that is now going to be widely available for physicians and hospitals to promote the adoption of electronic health records is really going to help. Because one of the things that for one of those EHRs to be certified, it has to be able to generate and consume clinical data in a standard format and be able to share it with other applications. So whereas like at Howard University Hospital, the EMR that we integrated with, it's a really nice EMR, it's diabetes specific, but when we started our integration discussions, we said, okay, well, can you guys work with a CCR or a CCD document? And they said, what's that? We said, okay, well, can you guys share stuff using HL7? What's that? And we finally said, okay, show us what you can do. Send us that data, and we'll map to it. And that's what, we had to, really do some heavy lifting there. But, a year from now, I think it's going to be, okay, we're going to be passing CCR and CCD documents back and forth, and both applications will be able to consume them and take the data and discretely populate their applications without all that extra effort. So this is certainly an instance where that stimulus funding has some of the right strings attached that will promote interoperability.
Well, that's true, but I also think that it almost comes down to where some provider of this service becomes popular, and that thrusts upon them to have that interoperability within them. Otherwise, they are not going to get there soon enough because of cost constraints and all, I guess.
Yeah, absolutely. And I think the other thing is that what we're starting to see, which 5 years ago was unimaginable, is that now patients are going into their doctors and saying, well, I have a PHR. I need to be able to share this with you electronically. And whereas 5 years ago they'd say, I don't even want to see that thing. Well, now it's starting to happen every day. And as we're starting to have physicians and hospitals and health systems call us and we ask, well, where did you hear about us? The number one the source of information now is, well, I had 5 patients in the last month come in and say I have a No More Clipboard account. Why can't you accept it? So, it's slowly building momentum. We still have a ways to go, but again, as especially consumers become more aware that this stuff is out there, and that now their doctors who want stimulus funds have an obligation to be able to share data electronically, we're going to see the accelerated progress over the next 24 to 36 months.
Thank you. If we have time, I have one more question for Sergey, which is, can you elaborate a little more about your profitability model? basically it's great service that you provide, but where do you make money from?
Right. So our model is a B2B2C. Basically, we design, we believe it's really important to design for the end user so they will actually use it, but somebody else has got to pay for it. So if you remember that chart where I was saying kind of chicken and the egg, where, for somebody to pay for something, they need, data that's valid, that requires the patient to press a button or to send the data. So, basically, our model is a monthly user fee, so if the more users you have, the lower the fee, basically. But it's a licensing fee model.
So it's the consumers who pay for it, right?
No, it's the sponsor that pays. So
sponsors
it's
that
either
pay.
health insurance company, pharmaceutical company. Yeah.
Okay.
One thing I just want to add to, the gentleman before had a very good question that, leads to many other questions, which is when you're on this payers, there's kind of three things that it comes to: the user need and user experience, the regulations and technology constraints. And I think, obviously these are large companies who are conservative, who need to abide by the regulations, that they need to do the right thing, yet they want to provide the best solution for their patients. And there are many companies out there, like Jeff's company, my company, who are trying to find that right solution. And the reality is, we really don't have all the answers. We are trying a lot of things. So I think, a mindset I would ask, all of you to think about as you talk to companies such as ours. Think about collaboration. Don't expect always to have the total solution. Think about how can we learn together, because and how we could share those learnings. Because this is just the tip of the iceberg. We really, the question with the regulations. Yes, there's a technological way to do it, so you meet the requirements. But patients will never use it. They will never download the thin client and call customer support 5 times to figure out why it's freezing on them, right? So we need to understand how we learn together and find the best possible solution for outcomes that's economically affordable and meets all the regulatory requirements.
Thank you.
So I think that we probably are going to have to wrap up now, and I'm just going to ask you, I want to thank everybody for being here. I'd like to ask you, I was listening to you two chatting before we started, and I picked up on a comment I think that Jeff made, and he said that I think that the next 6 months are going to be really exciting. And so I'm going to ask both of you to pull out your crystal balls and tell me, so 6 months, what do you think is going to be exciting? What's going to happen in the next, what's going to happen in the near term? What's the next big thing we can look for here?
Again, I don't have a crystal ball, but I think next, I'd make the horizon a little longer. I'd say the next 12 to 24 months, because the people who have to pay for it make decisions much slower than we would like them to. And they need data, they need feedback from the government agencies. There's a lot of work in Washington now in terms of, the West Wireless Health Institute is really spearheading a lot of those conversations with the FTC, FDA. So I think having people like the West Wireless Health Institute, the Connected Health Center, which is part of partners in DC, in Boston, having them help us in those conversations will have a significant impact, because we need a lot of clarifications too. Again, I think the key for it it's an iterative process between consumer acceptance and sponsor wallets opening up.
Okay, Jeff.
And I would just add that, I think right now we're kind of entering the Wild West phase, and you have this confluence of events coming together, all of the stimulus funding that's available, this shift again toward chronic disease management and away from traditional fee-for-service. You've got consumers increasingly engaged in their health care and wanting to use mobile devices. And what I would say is, now is the time to be out there innovating. Now is the time to be piloting these things and trying to come up with models that are scalable. And, to echo what Serge said, none of us have all the answers right now. People ask me, well, what's your business model? I said, well, what day is it and who am I talking to? 3 or 4 years from now, I'll say, well, here's what we have. It's A, B, or C. Pick whichever one you want. But today, it's, well, what are you trying to do? What are you trying to accomplish? What are your needs for you and your patients? And let's figure it out together. And now is the time to create what will become the standard business models 3 to 5 years from now. But we will never have a better time or a better opportunity to do that.
Well, thank you. And again, I want to thank all of you. There's a lot of great sessions throughout the day. Go get some coffee and get ready for the rest of the day. Thank you very much.